People calling ENT offices with symptoms could be confused. Is it a cold, sinus issues, allergies, or could it be COVID-19? Joining us now to discuss is Dr. Moeller, ear, nose, and throat specialist with Hartford Healthcare. Thank you so much for taking some time to chat with us today, Dr. Moeller.
Thank you for having me.
All right, so first of all, how can we differentiate between some of these more common symptoms?
Sure, it's a good question, especially with allergy season right in the midst right now. There is potentially a fair amount of crossover between the COVID symptoms and symptoms such as allergies. The hallmark symptoms of COVID are shortness of breath, cough, fever, chills, more flu-like symptoms. Allergies typically would be nasal congestion, sneezing, runny nose. Less likely to be COVID, but certainly some possible overlap.
So how did your practice initially react with the pandemic?
Yeah, good question. So we were able to transition very quickly to telemedicine, which was really a wonderful thing for patients and a way to keep our practice going. Our feeling was we could keep patients out of the emergency room, potentially putting them at risk for COVID, and still be able to offer the care that they needed. So telemedicine was really key initially.
And you've kind of started that transition to back to in-person visits. You're doing elective surgery again. What are those protective measures that you've put in place for patients and staff?
Sure. So we've been seeing patients for about 6 weeks in the office now, and it's transitioned pretty quickly back to in-person. We're still doing telemedicine, but most patients really want to come into the office. But obviously, it's vital that patients feel safe. All of our staff is required to wear masks throughout the day. We're taking extra cleaning precautions. In our field, we do perform some procedures that potentially could be considered aerosol generating procedures. When that is the case, we close down the room for at least 20 minutes. We have a HEPA filter running in the room. So we've been very careful to keep the environment safe.
All right. All good information there, Dr. Moeller. Thank you so much for your time today. We appreciate it.
Thank you for having me.